also wanted to ask you about your recent experience with removing a 140-pound tumor from a patient. The patient apparently had the tumor for many years. How was she finally diagnosed?
She couldn't walk anymore. So this lady, and she's given us permission to use her name. In fact, I wrote a piece that will, as I understand, appear in Cure this summer too, so I'm thrilled about that. So Mary Clancy is her name, and she's, I just saw her in the office this week. She's amazing. She is one of those folks that really defines what it's like to be a survivor. So she had a 140-pound tumor, which was about half her body weight, and had this growing inside her for at least a decade. And although it had some experiences with, she has a doctor that she sees, sometimes these things get so big that you just assume that people are heavy. So this was missed. She as she describes it, she said, I just thought I was going to be one of the roly-poly ladies in my family. And so and since it was slowly over time, but it got to the point where she couldn't walk anymore. So her son called the EMTs, they brought her to the hospital, and they put her in the CAT scan, and I have this CAT scan kind of emblazoned in my mind, this picture of this belly that's so stretched out and all of it being this tumor. And so they sent her down to us, and she's just amazing. So we talked about, how this, she goes, here I am, I don't know, and she had a big blood clot in her leg, and her leg was swollen, and so there were a number of other things that she could barely speak. She could probably get through 2 words without having to breathe again, because the tumor was pushing up on her lungs as well as on the blood vessels in her legs. The biggest one I've done before this was probably about 50 pounds. So this was a bit of a challenge for all of us. So I put together the surgery team to do that. And fortunately, with my hospital at Lehigh Valley Health Netowrk, we have really good specialists in a lot of areas. And it really took all of us to get her through this, as well as her, and her spirit. So the piece that I write about is that, Mary knew from the very beginning that we would be fine with this, and even though none of us had truly done this before, she had all the faith in the world that we could do this. And we were confident that we could get her through this, but it takes some time to think about it. How am I going to do this? And as my residents say, how did the guy with the scrawniest arms in the hospital pick up a 140-pound tumor? Well, I didn't. You have to plan out this beforehand. So I operated on her side, and I simply, once I attached all the blood vessels, I rolled it out to a waiting cart and let someone else lift it. So once you think ahead, you're okay. But it did take a lot of planning, and the other part was, when is she going to get better, and is this cancer going to need to be treated? Is it a cancer? So all that sort of unknowns that, as the physician, you can really see how these all stack up, and discuss them with her. She just, I can't live like this. I got to get better. Mm-hmm. So it turned out that she had an ovarian cancer, but it was a low-grade one. It was all confined to the ovary, and because we were able to get it out without breaking it, she didn't need any chemo. But it really took her over a week, maybe 10 days or so, to get her muscles to be able to breathe again. She was on a breathing tube. Mm-hmm. And talk about humor. The first thing she wrote, we have an iPad that you can communicate with while the breathing tube's in, and she writes, "I can see my ankles again." and she could. So her humor and her spirit were at least as helpful in getting her through this as we were. And she just did beautifully. And she's been a really important spokesman for what it means to go through this experience and how being optimistic and being hopeful can get you through. We still see her on her monthly or every 3-monthly visits, and her cancer remains in remission. And I expect that she'll do really, really well. And she just said this week, I'm out gardening and doing the things that I like to do. And I think that's it. So cancer survivorship is not about surviving. It's about learning to live and living in the best way and most meaningful way you can. And although she still has some limitations, she just finds joy in every day. That's what it's all about. And that's why I do this job, for people like her.